Hello, I'm Dr. Laurel Martin, a proud graduate of the University of Iowa and a full-time wet-fingered clinician. I deal with the same struggles on a daily basis that most, if not all, orthodontists do. BondAligner is a product that was developed in order to address some of those specific common problems. I've been extremely disappointed in the inability to bond auxiliaries to aligners and therefore achieve the same results we look for with our traditional appliances. Teeth not tracking and the inability to bond in our early systems resulted in frequent failures and increased office visits. Bonding directly to teeth as our alternative can cause unwanted movement in anchorage sites. Reinforcing dimples placed in the aligners in order to facilitate minor movement and increase retention is an important part of getting those results. Root movement has always been an issue, and maintaining our aligner adaptation is critical. The ability to troubleshoot cases is so important for us as clinicians. We want to be able to do that with our aligner systems just as we do with traditional appliances. BondAligner has been my solution. It was developed to bond to clear thermoform plastics including Invisalign, Essex, Trutane, and BioCruel with the similar shear bond strength that our traditional appliances bond to prepared enamel. At last, in your practice, you can reliably bond to aligners, increase your retention with your dimples and minor movement, and therefore improve patient and doctor satisfaction. Bonding to aligners reduces that unwanted movement at anchorage sites and therefore also reduces our need to relieve aligners when we're bonding directly to teeth, which can truly increase chairside time. Reducing the need to alter the thermoform plastic or the aligner material increases the interface between the tooth and the aligner and therefore facilitates more reliable tooth movement, critical to achieving those results. I hope you find BondAligner is as beneficial to your practice as it has been to mine. It has reduced emergency visits, has increased my ability to achieve the results I so desperately wanted with my aligner systems, has reduced chairside time and increased patient satisfaction. Here's how simple and easy it is to use. Take your aligner, determine the position that you want to place your auxiliary. For demonstration purposes, I've used a metal button. Place the material, the BondAligner, on the back of the button. Position it on the aligner. If you like, then you can remove excess and cure. And if you like, you can test the strength of your bond with an elastic before you deliver it to the patient. There are a few technique tips and hints that I've learned over the years. I'd like to share those with you. One, you can take a fine tip Sharpie and place a mark on the aligner where you'd like your staff to bond the auxiliary. That way you make sure you get your vector of forces set up just like you would like them to be. Two, it's not bad to leave a little flash. So when I recommend removing a little excess, leaving a little bit around the rigid pad of your auxiliary is a good idea. It increases the bond strength. When you do get bond failures, the bond failure is between the rigid pad of your auxiliary and the BondAligner, not between the BondAligner and the overlay, the matrix that you've got. So by having a little bit of excess over, it does help with the bond strength. If you do get bond failure and you have BondAligner left on your aligner, you need to get in with a handpiece to remove that because it's a pretty strong bond. My staff has actually popped the heads off of buttons before trying to remove a button that's been placed in the wrong position. Then, if you want to facilitate root movement, I use the Tomas Bondable Hooks. These are designed, there's a left and a right version, to be bonded to teeth and to aligners. They come in different lengths. I just shorten them depending on, again, the vector of force I desire and tissue comfort for patients. So the Tomas Bondable Hooks are available. You need to show your staff, again, where to place them. Bond them on. They bond just like your other auxiliaries, metal or ceramic or plastic. And the last thing I use that's a huge auxiliary when working with BondAligner and tooth movement are TADs. I frequently place TADs in order to maintain aligner adaptation and facilitate movement in segments or individual teeth that I couldn't otherwise achieve with aligners alone. An important point to remember is that BondAligner was developed to adhere to clear thermoforming materials. It's not recommended for use with cloudy thermoforming plastics. The ability to bond auxiliaries to aligner materials has had a huge impact on our practice here. Fewer emergency visits and better treatment results have increased practice efficiency and satisfaction for all. Difficult movements are now achievable with aligners that were previously thought not to be possible. You can build those movements directly in from the very beginning and be able to back them up, or jump in and troubleshoot when things aren't tracking. I look forward to hearing how you are able to utilize this fabulous new product in your practice. I hope you enjoyed as much as I have.